you have undergone a good Swiss Dental Academy GBT training using the Airflow Plus powder. Professor Magda Menzi, would you like to quickly introduce yourself?
Yes. Hi, everybody. So it's a pleasure to be here with you. I don't know what time is it in your part of the world. Here is night. And I'm very happy to stay here with you during this hour and a half presentation with Neha. We worked together on this educational form for you about the new Perio Flow nozzles, but also about the indication of these nozzles. So you know that I worked in Italy, in Brescia, as a researcher and professor in periodontology and oral surgery. And I'm also a private practitioner in periodontology and oral surgery. And I'm a professor in the dentistry school and dental hygiene school here in Brescia. And I work with EMS since 6-7 years, and I'm very happy to share with you all my clinical and scientific knowledge today.
Excellent. Thank you very much. So we begin. We will, just to let you know, we will be having a roundtable panel discussion with Professor Magda Menzi, Bridget Shrinai, and Dr. Lutfia Alharti on the 26th of November at 6 p.m. CET. So that is the time where we will address all your questions in case we have not managed to do so during this webinar. So to begin, once again, the importance of the Perio Flow nozzle. This has been a very crucial part of our airflow journey, including, of course, our guided biofilm therapy, a very crucial step here, which essentially definitely has been neglected. Once again, a reminder to all our SDA trainers, this presentation has been made exclusively for you clinicians across the globe. So a reminder, as Mr. Buena always wanted, please use the Perio Flow nozzles only with tabletop devices. So this is very, very important because in order to avoid any complication and to assure the best safety you can have when you're working. So the objective was to explain the indications, the contraindications, any complication, and to assure the best safety you can have when you're working. Why did we really develop this module? So the objective was to explain the indications, the contraindications, the precautions, as well as recommendations of the Perio Flow nozzle that we have today. Of course, all this has already been mentioned in our treatment recommendations and guided biofilm therapy brochure as well. But it's a good opportunity today to actually explain, and you can save all this information. You will receive all this information, the entire PowerPoint presentation as well, as soon as we will send you this. We will also be discussing the benefits of the Perio Flow nozzle because I think, again, this has not been clearly appreciated or understood. Professor Menzi will talk essentially on the different clinical situations from her experience with the use of the Perio Flow nozzle. Another, which of course include the use not only in natural teeth, but also around implants. Finally, we will be discussing a lot on the safety and all the key considerations while we use the nozzle so as to ensure the optimal treatment for our patients. And finally, of course, this is so that when you are in front of participants, in front of clinicians, you are in a position to train them and to educate them and answer all the questions revolving around the Perio Flow nozzle, especially with respect to correct usage, technique, and technology. We're essentially, of course, this is addressed towards all clinicians, including dentists, specialists, as well as dental hygienists across the globe. So today we have done a lot of market research, and we have clearly seen that we do have a lot of challenges with respect to the Perio Flow nozzle, beginning with insufficient training, limited understanding of the design, of the quality and the technology. We have a lot of issues with accessibility. There are many clinicians across the globe who have never used the nozzle, as a result of which they are definitely scared, because what they've been doing till now is working very well, but we need to overcome all these challenges. Safety concerns, and here I think we would emphasize a little bit more, because we have seen this to be the biggest challenge. This is also related to incorrect, I would say, peer-to-peer communication. Also related to lack of knowledge, especially with respect to clinical applications. There are a lot of apprehensions, again, related to the safety issues. And today, according to the market research, we have seen that over 50% of airflow prophylaxis master that have been sold in the market, the Perio Flow nozzle box remains unopened and untouched. And this is a global statistics. So definitely it is time that we focus and we overcome all these challenges. And we hope to do so, Magda and myself, during this particular presentation. So coming back, giving you a little insight on the history of this particular nozzle, we know that this is absolute original EMS technology. EMS has been the inventor of this patented nozzle. We've had 3 generations, and the latest of this was released in the year 2020, in fact, just last month. We will talk about this nozzle as well, the new nozzle, a little bit later in detail. But you can clearly appreciate itself just from looking at the pictures right here, the clear difference between the latest and the first one. So of course, it is all ultimately the original EMS technology. So as far as design of the Perio Flow nozzle is concerned, we must remember whether it's the first one or the latest one, basic features still remain the same. Once again, EMS is the original inventor. We have a lot of evidence from the time the nozzle was first used in the market till date. So this is over 10 years of clinical evidence. This nozzle still continues to be used with a special handpiece. You see the design is definitely long, and I would say longer and flexible. It's made up of a special plastic material, which is a one-time use disposable material. The advantage, it has easy access to all the different areas, as a result of which increasing overall efficiency with respect to clinical outcomes. It is proven, once again, to be safe on the root surface. The markings of the nozzle, whether the first generation or the latest, still remain the same. That is 3, 5, 7, and 9. Apologies, the first generation did not have markings. From the time we have the second generation to the latest, we have the same markings. Big advantage, it is very comfortable to patients, hence the need to anesthetize is limited. And the nozzle has essentially 4 outlets. You have 3 outlets for the air and the powder, and 1 outlet for the water. And this outlet for the water is essentially only in the vertical direction. So that is very important to note. What are the big major differences between the generations? So I think let's compare the second generation with the latest. We have seen that it is definitely 25% slimmer. The body geometry is definitely changed with respect to its flexibility and adaptability in different areas in the mouth. There is a groove, which we will talk about a little later, which is definitely enhancing the safety of this particular nozzle as a result of the pressure reduction into the periodontal pockets and around implants. Because of the design, the length, the slim aspect, you are in a better position to reach and treat more around the periodontal as well as the peri-implant areas. And of course, this leads to greater efficiency and once again, higher patient comfort because of the overall new design, which was launched in September. So what are the unique features of the new Perio Flow nozzle? I think the most important is the fact that we have now a groove into the nozzle, which allows the air, water, and powder to freely circulate when you have placed the nozzle subgingivally, as a result of which the overall pressure is reduced inside the periodontal and peri-implant tissues. Let's have a look at this interesting video as we talk. So definitely with this nozzle, we have an upper edge, and we are definitely a class apart when we talk about subgingival treatments in comparison to our competitors. So just to give you a quick overview, in case you are ever faced with a challenge of any question with respect to competition. So here we talk about the LM nozzles. So the biggest difference, once again, this is metal, it's non-flexible. We talk about Metron. Again, it's non-metal, but it's not flexible. From Duch, we have a metal one. From NSK, we have a plastic one, but it's a very thick plastic and it's not flexible. We have another subgingival nozzle, which is from Action. It's metal, so once again, not flexible. Woodpecker, it's a non-metal, non-flexible nozzle. And finally, from Cavo, which is a metal nozzle. The reason we're focusing a lot here on the metal aspect is clearly the fact that it's to talk about accessibility and higher efficiency.
Okay, Neha. So before to move on my part of the presentation, I would like just to add something to what you said about the advantages of the new Perio Flow nozzles, because those small changes in terms of technology, shape, dimension, the groove, are a very important and big change clinically. Because I had the opportunity to test the new Perio Flow nozzles during these months, and really from a clinical point of view, you really have a very better accessibility to the pockets. So sometimes you just need to move a little bit the gingival margin with the probe, and then you insert the tip of the nozzles and you can go into the pockets without any problem and without injection or anesthesia, especially during the maintenance therapy, supportive therapy in the residual pockets. And the flexibility, it's really better, and the pressure is very well controlled thanks to the new shape. And I want also to add that I totally agree with you and with Mr. Brunner. Please try not to use the Perio Flow nozzles with the handy or with the chair hand pieces, because you can't modulate the pressures, you can't modulate the quantity of powder, you can't modulate the quantity of water. And you know that with the airflow prophylaxis master, you can do that. You can have the possibility to set the quantity of water, the pressure, and the quantity of powder. And you know that those are the parameters that change the aggressivity of the powders in the pocket. So you exactly know what are you doing with the airflow prophylaxis master. So you can modulate the pressure, the quantity of water, the time, and modulating these three parameters, you can work in any clinical conditions. And I'm gonna explain you with the clinical pictures and videos what I'm talking about later during the presentation. So I need to move on the next slide. So let me see if I'm able to manage the presentation, Neha, because okay. So the treatment goals of the Perio Flow. So not just the treatment goals of the Perio Flow, but the treatment goals of the non-surgical therapy are try to eliminate the bleeding on probing, to reduce the probing pocket defect. I don't know why we changed the slides, sorry.
One behind.
I can't come back, Neha. I don't have the possibility to move the slide. So I need to ask you to do that for me. Okay, stay on that slide. So the treatment goals in non-surgical therapy are to eliminate the bleeding on probing, try to close the pockets or reduce the probing pocket defect, and try to obtain bone level stabilization. But you also know that sometimes the mechanical debridement with the PS tip could be not sufficient. Why? Because we need to disrupt and to disgregate the biofilm subgingivally in a very effective way, to detoxify the root surfaces, the implant surfaces, and try to reduce the bacterial load by a dilution that allowed healing in the different patients. And so for that reason, if you think about a root surface totally contaminated by the biofilm, it's very difficult with the PS tip to be able to remove completely the biofilm from this surface. So we need some supplements, something more. And the Perio Flow is this something more. And it's really better to use an air-driven handpiece to remove with the powder the biofilm from the root surface compared to use a mechanical debridement. So the combination of Perio Flow and PS tip could be the best option to obtain the goals on non-surgical treatment. So the next slides, because I don't know why I can't move. Okay, so the next slides show you where is the step where we need to use the Perio Flow. So we recommend to use the Perio Flow nozzles after all the supra and subgingival biofilm removal up to 4 millimeters with the airflow, and before using the PS tip into the pocket. Why? Because we want to remove the biofilm before from this root surface, and then use the mechanical instruments only if we have any detectable or visible calculus subgingivally. Because if not, if we don't have any calculus, we don't need to use more aggressive instruments more than the Perio Flow nozzle. So it is the same in the supragingival treatment, you know. So if you have just the biofilm, you use just the airflow. In the pocket, so in a root surface, if you have just biofilm, you use just the Perio Flow. If you have also calculus after the biofilm removal, you use also the mechanical instruments. It's the same concept. It's obvious that we need to consider the contraindication. So we're going to talk about these points in the next slides. And it could be good or indicated to have a radiograph, but it's not mandatory, because what is very important is to consider the clinical condition of the soft tissues before using the Perio Flow nozzles, not just the bone level or the volume of the bone defect. It is important. So as a periodontist, I always have the radiograph of my patients, but these instruments, especially the Perio Flow, is also for the dental hygienist. And if the dental hygienist needs to treat a patient in a supportive therapy and she doesn't have the X-ray, but she has the probe, and the probe is really the guide of the guided biofilm therapy. So if you really check the volume of the pocket, the condition of the soft tissues, the depth of the pockets, you can really realize if the Perio Flow nozzle is indicated or is not indicated. So let me try to go ahead. No, I don't know, Neha, I can't move, so okay, thank you. The need for usage. So when we need to use the Perio Flow nozzles, of course, the most important indication is the maintenance. So the supportive therapy or secondary prevention, when you have residual pockets from 4 to 9, 10 millimeters. Because in those conditions, you have, of course, pockets with good soft tissues condition, probably without calculus into the pocket, so on the root surface. And we have a lot of scientific evidence to tell us that this treatment just with the Perio Flow nozzles is effective as well the mechanical instrumentation or the manual instrumentation. So we are less invasive, we need less time with the Perio Flow, and the comfort from the patients is higher. So this is the best treatment for the supportive therapy. But we also can use the Perio Flow nozzles, and I really recommend to use the Perio Flow nozzles in the pseudo pockets, for example. So when you start with the active therapy in gingivitis cases, you would have very deep pseudo pockets, like 6 millimeters, with bleeding and probing, but there are no problem. You can remove the biofilm, the plaque in these pockets with the Perio Flow nozzles. It is very effective and no risk at all during this kind of treatment. Of course, is needed during the maintenance of the transmucosal tunnel around the implants, the healthy implants, because we need to maintain the implants healthy, and also during the treatment of mucositis and sometimes in perimplantitis. And of course, during the active therapy, you can use the Perio Flow nozzles to improve the results, the clinical benefits of your treatment with the PS tip or with the PI tip in terms of when you have implants, because we have evidence on this issue, and I'm gonna show you the results of our study, the first study where we use the Perio Flow nozzle in combination with PS tip during the active therapy in patients with periodontitis, and you can really improve the clinical results. But you need to consider some clinical contraindication or recommendation that we will explain during the presentation. So the next slide,
breaking
please.
News. This is breaking news, Magda, that we can use it in
yeah.
Excellent.
they need to wait the end of the webinar to know.
Exactly. You let out the surprise too early. Okay.
Yeah.
Okay.
So just to summarize the indications of the Perio Flow nozzles, you know very well these draws. During this subgingival instrumentation, up to 9-10 millimeters, you can work all around the roots in different sites with the Perio Flow nozzles to remove effectively the biofilm. And remember that the aim of the non-surgical therapy is to remove the biofilm. Yes, we need to remove also the calculus, but sometimes we are not able to detect or to see, to identify the calculus. And it is more important to decontaminate the residual small pieces or smooth pieces of calculus than try to planing the root with the manual instruments. So really, the Perio Flow nozzle is something that we need to improve, and we need to try and test and use in our daily practice because it's like the airflow supragingivally, and you know how many benefits you can have in biofilm removal with the airflow supragingivally. So we need to change our mind and try to apply the same rule with the Perio Flow subgingivally in the pockets. And the same is on the multi-rooted teeth, especially if we have furcation, lesion on the furcation, because you can clean also this area with the Perio Flow. And of course, the most important indication, the transmucosal tunnel around the implants. And I'm going to show you also some really important clinical benefit when we need to remove the biofilm in between the threads of the implants. We don't have any other instruments able to remove the biofilm around the threads. Because all the instruments are rigid, are stainless steel curette or titanium curette or plastic curette or different ultrasonic or sonic instruments, but they are not able to work as the Perio Flow nozzle. So the next slide is Neha, can you move?
I think, you can change it. You're doing...
Okay. It's very slow. I don't know why. Probably connection. Sorry. All the word is connected in this moment, so probably all the connection is very slow. But anyway, so here, I think you know very well these pictures. I worked on these some years ago, and I think that it's very useful, especially for the new users, because they summarize very well where you need to use the Perio Flow and when you can use the Perio Flow safely, when it is not recommended, where is not needed. Because, for example, in healthy teeth with a very narrow sulcus. Oh, now it's moving ahead. I don't know why. Probably because I touched something. So can you come back, Neha?
You want to go back? Okay.
So when you have just 2, 3, or 4 millimeters of sulcus in an healthy teeth and you have the biofilm to remove, you don't need the Perio Flow, you need just the airflow. If you have a gingivitis up to 4 millimeters, you can use just the airflow. If you have a pseudo pockets, yes, you could need the Perio Flow. But if you have a pocket of 5, 6, 7, 8, or 9 millimeters, yes, you can use the Perio Flow. But if you have a very inflamed tissue in a very deep pockets during the active therapy, it is not recommended. And I'm gonna go into those details later in the next slides. And on implants, it's more indicated, because you know that also in healthy implants you could have very deep transmucosal tunnel also of 5, 6, 7, or 9 millimeters. So you need the Perio Flow in healthy implants, in mucositis, in peri-implantitis, but of course, it's not recommended if you have a peri-implant abscess with suppuration or with fistula, because it's a risk. So we can go ahead now, and in the next slides, you can see two pictures. One, you can move, Neha. Okay. You can see the pockets in a natural teeth here, of 6 millimeters, more or less, in a very good soft tissue condition. So with keratinized tissue in a mesiobuccal site, and during an active therapy, these pictures, and we are using the new Perio Flow nozzles. So you can see that it's very comfortable and easy to insert in those kind of pockets, and you can work up and down to debride, to disgregate the biofilm before using the PS tip if you have any calculus, and also into the furcation area, as you can see in the right part of the slides. Okay, so next slide, please.
Okay, it is telling me that Magda is controlling the screen. Okay.
So I can try, Neha, but so let me try. Okay.
I think it's slow. It's just slow.
Very slow. Yeah, it's very slow. It's very slow. So I think that we can continue like this. So okay, so you can move, and I tell you when I need to change the slide. Okay, so around the implants. So it's very, very important, or sometimes necessary, to have the Perio Flow nozzles. And you can really understand very well looking at these draws and these pictures. If you have biofilm in between the threads of the implants, it's impossible with rigid instruments like the PI tip to remove the biofilm. And this is very clear here in this in vitro study and pictures, where you can see that you can remove the biofilm with the powders, but it's impossible to remove the biofilm between the threads with the conventional instruments. So please try to remember this picture and try to understand that in this condition, you need to use the Perio Flow nozzles to be effective in maintenance or in treatment around the implants. Okay, the next slide. Of course, you can see here different clinical cases in implants, around the implants. So when you don't have accessibility, you need to have something flexible. So like here, because you have sometimes bridges or crowns or some framework that don't allow you to use the conventional instruments. You need to angulate the instruments, or look at this picture on the right side here. You need really to flex to angulate the Perio Flow nozzles to go into the transmucosal tunnel and try to remove the biofilm. And we need to do that, or we need to go over this over contouring crown and go into the transmucosal tunnel again, or in the palatal sides, or around some bars or framework in screw fixed implants work. So we can go ahead on the next slide. Okay, remember that the transmucosal areas are the most important areas to maintain, to stabilize the implants and to maintain healthy implants. And unfortunately, not always the situation is like this with not so deep transmucosal tunnel. So in the, I think 80% of cases, we have a different condition, and please Neha, go ahead in the next slides. We have situation like this. So look at this X-ray. So we have here the first threads of the implants. So the level of bone is here, but we have all this part of transmucosal tunnels. So soft tissues. We have a pocket here since the beginning of the surgery. So we need to help the patient professionally with recall, periodic recall, at least every 3 months to disgregate the biofilm here with the Perio Flow and to maintain a balance between aerobic and anaerobic species, microbiological species, because if you don't do that here, after 4 months, you have Porphyromonas gingivalis, Aggregatibacter, and all the red complex. And you're going to have before, at the beginning, mucositis, and then in susceptible patients, you're going to have periimplantitis.
Okay. Thank you, Martha. Trying to move the slide. Okay, so we come after now that Martha has explained a lot about the different clinical applications with respect to natural teeth as well as implants. We do have some specific recommendations when we talk about the safe and optimal use of the Perio Flow nozzle. Once again, most important, use the Perio Flow nozzle only with tabletop devices. Magda already spoke about the reasons why, but it's very, very important that today all the complications that have occurred with respect to the Perio Flow nozzle have happened because of the use of a handy. I would say 95% are reported because of the uncontrolled output pressure. So in order to control this, we must only use this nozzle with tabletop devices if we want to ensure safe and efficient treatment. Use of a radiograph is always, as I discussed with Magda as well, it's always good to have a radiograph, but of course, it's more important that the soft tissue condition of the particular patient is taken into consideration before we use a Perio Flow nozzle. Once again, we have a very silly study, as you know, Magda, where they used a Perio Flow nozzle to treat open surgical procedures. So clearly the Perio Flow nozzle is meant for subgingival use when you have a periodontal pocket between 4 and 9 millimeters during non-surgical use. So, of course,
I don't know. Why they use the Perio Flow nozzle in an open flap debridement? You can use the airflow if you want. So
exactly, and this was published in a high-impact peer-reviewed journal, which was shocking. But okay, well, let's not discuss that. But it's important that when you have probing depths more than 4 up to 9 during non-surgical use, only is when you would consider using the nozzle. Once again, we only recommend that you use the erythritol-based plus powder when you use this nozzle subgingivally. Of course, this nozzle has to be used with a special, the Perio Flow handpiece only. So please do not try to use it otherwise. We highly, once again, recommend it's Important to be trained before you use this nozzle, at least to understand or to have seen a demonstration before we use the nozzle in order to optimize 100% safety, or I would say safety as far as possible. Always check the patency. Check, that means all the openings, the air, powder, water are all fine. So we highly recommend, I think you must have seen this in our hands-on demonstration that we did on the 19th of October. Please check that before you insert it into the periodontal or around the peri-implant tissues. When you are treating multiple sites, it is once again important, even in the same patient, after you have treated about 20 sites, we highly recommend that you change the nozzle. So for example, a patient comes with chronic periodontitis or multiple pockets which are deeper than 4 millimeters. Please, after 20 sites, change the nozzle, because after 20 sites, the tip of the nozzle bends. It could be a bit painful. And another reason is the openings may slightly enlarge, because finally we're using a powder. So we do not want any excessive powder to be inside your periodontal pockets or around peri-implant. So after 20 sites, recommended to change the nozzle. This is a very important point. We have mentioned it in the hands-on, but please remember, this nozzle is site-specific when we talk about natural teeth. So of course, when you do your initial assessment of the soft tissues, this nozzle is only to be used where you have deeper periodontal pockets. So for example, in your central incisor, you may have 3 pockets. You may have buccal, you may have mesiopalatal, for example, but only when you have a pocket which is deeper than 4, please use it only in that pocket. Okay, but when we talk about implants, remember, we recommend that you use it along all the 4 sides. That means at least mesial, distal, buccal, and a palatal or lingual side. The power water recommendation. So we have seen that this is also a little bit of a confusion. All our literature today supports the fact that Perio Flow nozzle should be used at minimum 50% power in order to have efficient, optimal results. Water, always 100%. This is again because of the fact of acoustic streaming. We do not want any powder to remain in the pocket. And more important, it's a biofilm that all needs to be flushed out. So water should always be 100%. Do not use the same nozzle. As we know, it's a one-time use disposable nozzle. We do not want any cross-contamination or cross-infection. Correlate if possible. Once again, if you have an X-ray, it's ideal, but soft tissue condition is very important. Do not push the nozzle. If you have a narrow periodontal pocket, even if your depth is more than 4 millimeters, do not push the nozzle. So this sometimes is a challenge with the older generation of the nozzles, but with the newer generation, we hope that it is more versatile. Never push.
Sorry if I
yes.
Sorry, Neha, I would like just to add something, because when I give my lectures of courses or hands-on, this is a very important point, because all the dental hygienists complain with me, yes, but when we have very thin biotype or narrow pockets, we are not able to put the Perio Flow nozzle inside. That's right. And sometimes we can't. So when we can't, because the condition, the clinical condition don't allow us, you have the PS tip.
Exactly.
And you can continue with the PS tip. So it's not mandatory. So we don't need to force the nozzles into a very fine and narrow pockets. We use when the condition allow us to use. If not, we have the PS tip.
Exactly. So please use the PS or PS instrument when you cannot, because it does also serve the purpose to remove biofilm.
Yeah.
Repeated insertion. So we will talk about the time. normally the time that is recommended. So now please note, we have over the past couple of years collected a lot of data, a lot of clinical evidence talking about the efficiency of removing biofilm in pockets in probing depths deeper than 4 millimeters. And we have seen that depending on the length, the depth of the pocket, you have to minimal use it from 5 up to 10 seconds per site. So this is a slight alteration from what we used to say in the past, because we've seen, again, the efficiency is compromised. So please note, and of course, it does not even make logical sense to have a specific time, because if you have an 8 millimeter pocket versus a 5 millimeter pocket, there is going to be some time by the time the biofilm comes out. So please note this little change with respect to the time usage. And when we say repeated insertions, if you have already treated a site for 10 seconds, please rest assured that the biofilm is out. Do not go back in and try. So repeated insertions are not recommended today. How would we use the nozzle? Once again, it's simple, vertical, overlapping, repetitive movements as you come out of the pocket. Okay, we will discuss this a little later.
Yeah, and so I think that we can move quickly on these two slides, because I need to talk with you about the precaution and the contraindication. But you know, Neha, that we prepared, so I prepared 3 very clear slides with the clinical picture, where I really can share with you which are the precaution, which are the indication, and which are the contraindication. But anyway, so in terms of systemic condition, so I can agree with the pregnancy and breastfeeding, but you know that I use the airflow and the Perio Flow in all conditions, because this is not an absolutely contraindication. But of course, when you have pregnancy or you have breastfeeding, so with caution. So if it is indicated, okay. If not, if you have infection or something like that, please don't use. But in active therapy, in initial therapy, so we always said, okay, no, it's not indicated, but now we know that it is indicated, and you can use with some discretion, and we will discuss later about this point.
Yes, we will be including this particular application and moving, and I would say increasing our clinical applications from maintenance to now saying you can use the Perio Flow nozzle in active therapy. Magda will talk about this literature a little later. So we have definitely, this is again something which is different.
Yeah, and also, so we are talking with our SDA trainers. So they are clinicians. So they know, I think that they know that the most important indications of the Perio Flow, so to have something able to disgregate the subgingival biofilm, is during the initial therapy, because that's the moment where you need to try to eliminate the more biofilm you can to obtain the results. But up to now, we were, I don't know, so we didn't have any evidences in the literature. It was not indicated. So we were a little bit scared in using in a field where it was not indicated to use the Perio Flow. But so it's a concept that everyone, I think, agree. So we can use if the clinical conditions are okay. And the absolute contraindication, I would like to talk later about this point, but in these slides, try just to remember that the extremely thin biotype and the presence of abscess are the most frequent condition where we say, okay, no, please don't use in this condition, because the risk of emphysema or the risk to spread the infection is too high, because it's not convenient to use in those two conditions.
Mm-hmm. Okay, so I think this is very clear, and I'm sure as we move along, this will become clearer. Please note, we are trying to reduce the contraindications, because this is, again, I think, a big challenge that we have seen, Magda, with clinicians, that they're scared because we have mentioned do not use in tuck, 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 tuck.
So when I need to use.
Exactly. So I think this should be now clear, that if you have a very, very thin biotype, or you do not have enough keratinized tissue, it's an absolute contraindication, but we will talk about this a little later.
Yes.
Okay. One thing before we go on to the more interesting stuff is a little highlighting on the fact that, yes, we are, as you know, EMS is a very ethical company. We have never hidden the fact. In fact, we have a lot of data, and today I can even discuss that with respect to emphysema. So agreed, yes, we have a lot of cases of emphysema. Let's understand what is really emphysema. So this is accumulation of air, as I say, into spaces, okay, into the soft tissue spaces. It is definitely a complication that could occur. However, it's not only limited to the use of Perio Flow nozzle. You can get emphysema with just the three-way syringe, or with an air rotor, etc. So it's not only limited. So please note that I think emphysema for me is more, I think it's been misunderstood, that Perio Flow means emphysema. So kindly rest assured, if you follow the right recommendations, the precautions, when to use it, when not to use it, you are, and of course, the soft tissue condition is priority. Trust me, you will be in a safe place.
Neha, I have been working since 21 years as a dentist, and I had 2 emphysema with a turbine during a surgery, okay, of a third molar, and I never had an emphysema with airflow or Perio Flow.
Wow.
So
exactly. I mean, this is really, but okay, we know that complications are always uninvited. In case you do have a case of emphysema, how would you really recognize it? As we say that there is some amount of crackling, there is definitely going to be pain. And sometimes in acute cases, it does extend onto your facial or the neck swellings, could be a possibility. As far as reporting the correct cases, today the incidence and the prevalence of emphysema is extremely low. This, as you can see, this is, of course, Professor Fleming's data from 5 years ago, and it hasn't changed much. At EMS, today, we are selling over millions of Perio Flow nozzles, which have been treated with the plus powder. And we have seen till date, so this 78 is a number from last week till I finished this presentation. So in 8 years, that has the second generation was launched, we have just 78 cases. But of course, agreed, many cases are unreported today. And once again, we highly recommend every clinician watching this presentation, please approach us. Let us know if you have any complication with respect to emphysema, because all cases are followed up personally. We contact the clinicians and we follow up the case till it is closed and the patients are back to health. So what do you really do when there is a complication? So Magda, maybe you want to highlight this.
Okay, so I think that it's not complicated to follow an emphysema. It sometimes happen, but it could be I don't know, difficult probably for a dental hygienist if she or he is alone, because they can't use medicines. They can't recommend or prescribe antibiotics, cortisones, or anti-inflammatory. And so I think that we need to know what is the emphysema, but also that the first thing is keep calm. It's nothing so dangerous. So it's just some air that you can feel with your hand. You can try to move this air out with a soft messages. You need to calm down the patients. So you need to attend your patient for 30 minutes, 1 hour in your holding room, for example. And if everything is stable and okay, so what we recommend is just to prescribe 3 days of azithromycin, so antibiotics, or amoxicillin, because we were working in the biofilm, so it could be possible, a remote possible to spread the infection. So you need to cover to protect your patient with the antibiotics and some anti-inflammatories to speed up the healing, so the reduction of the edema, of the emphysema during the next days. So in my case, I usually use an injection, an intramuscular injection of dexamethasone, because I can use it and it is very easy. So it just ends the problem with this injection, local injection. But normally we used to prescribe just, I don't know, ibuprofen or any other anti-inflammatory and some antibiotics for 2 or 3 days later. And that's it. So it's very easy to follow up this case.
And I would like to add that at EMS today, we haven't had any case which has been fatal. So all cases have recovered and complete health.
Yeah. And really, Neha, we need to stress this point that it is not a problem of the Perio Flow nozzle. So we can have the same problem using the airflow in a sulcus. When we remove the biofilm from the sulcus, when we use the air syringe water to check into the pocket if we have any calculus. So it's not for it's for the Perio Flow nozzles. I don't know why so many clinicians are so scared in using this nozzle. Probably because we can see into the pocket. So we don't have the same control, the visual control. But it's not more dangerous than the instrument instruments. So please use the nozzle, because if not, so if you have the Perio Flow handpiece and the Perio Flow nozzles and you don't use because you are scared, so where is the issue? When you need to use, and if you go ahead, Neha, we can go into the detail, the clinical detail, where we really have the condition to work safely, and where we don't have, where we don't have this condition. So I prepared with my group these 3 or 4 slides with some clinical examples. So it's very recommended and safe in dental pockets during the supportive therapy or during the active therapy. Use the Perio Flow by the dental hygienist or the dentist, no matter. If you have 5 or 6 millimeters pockets, and also if you have 7, 8, 9 millimeters pockets, but with very good soft tissues. Normal tissue means not swollen, pin colored, keratinized tissue attached to the gingiva, with not profuse bleeding on probing, with no suppuration on probing. In those conditions, independently from supportive or active therapy, you can use very safely the nozzles. The next slide is another color, not red but orange or yellow, because it's up to you. Why? Because when you have pockets during the supportive therapy or active therapy with some bleeding on probing, without suppuration on probing, but with pockets under the mucogingival line or under the myloioid line. I don't know if you say linea myloioidea, how do you say in English? Myloioid line in the floor of the mouth. You have a line in the lingual part. You don't have to go over that line. So in this condition is not contraindicated, but what we recommend is to use our finger, you can see here in the slides, to press the mucogingival line and to stop the air, but you can work gently with the Perio Flow and contain the air and work around the implants, around the root surface, even though you have this critical condition. It is not recommended, in the next slide, so not for dental hygienists and not for dentists, neither for dentists, if you have this kind of condition. So very profuse bleeding on probing, suppuration on probing, periodontal abscess, fistulas, very deep pockets over and under the mucogingival line in combination with these clinical conditions, so bleeding, profuse suppuration. In this condition is not indicated, but is logical. I think that you already know that in this condition you need to treat with the PSD and with some coadjuvant, for example. So I use the topical antibiotics in this condition. I try to convert the clinical situation in a more stable soft tissues condition. And the next appointment, I use the Perio Flow nozzles in a very safe clinical condition to disgregate the biofilm. So it's obvious. And when we talk about implants in the next slide, we have similar condition. So it is recommended and safe during the supportive or active therapy if you have 5, 6, 7 millimeters of transmucosal tunnel with normal tissues and not profuse BOP. It is up to you if you have very deep transmucosal tunnel, because usually when you have these very deep transmucosal tunnel, you are over the mucogingival line. So if you want to use, please use the attention, pay the attention and press the mucogingival line and use gently. But it is not recommended, absolutely not recommended when you have those clinical condition. So with a lot of suppuration, with various swollen tissues, with no keratinized tissues, with no structure density of connective tissue to contain the air. In this situation, you need to convert this inflammatory situation in something more stable. And in the next appointment, you could use the Perio Flow nozzle. Okay, we move ahead in the next slide, please. And can we use, so the question is, can we use the nozzle around all the different kind of implants? Of course. So we have a lot of evidence and a lot of clinical experience on that. You can use these plastic nozzles with the plus powder in any kind of implants, any kind of titanium, any shape, any brand, in everything you want, you can use safely these nozzles and the plus powder. And in the next slides again, I know because I have experience, and these are data that Neha and myself try to collect from my randomized clinical trial from the raw data, So I treated at minimum 2,000 sites between 5 and 6 millimeters around natural teeth, and 850 sites from 7 to 9 millimeters without any problem, without any emphysema, without any side effects, without any discomfort from the patient. So I can really tell you, please try to make your training, try to understand very well the indication and the contraindication, but then use the Perio Flow nozzles during the treatment as a combination with the PSD.
Yes, Magda. So this is just data, just for your information to all our clinicians. This is just data of 3,000 sites from post studies. And today we have over 33 clinical studies proven in literature
Yes,
with
so
our
you can
different
imagine. Yeah.
So we have a lot of data to support the safety, efficiency, and comfort of our nozzle. And I think
Yeah.
especially with the new Perio Flow nozzle, I think we are now definitely a class apart.
Yeah.
So just to go over who are, we always get this question from our SDA trainers. Could you please let us know who are our key opinion leaders when we talk, if you want to have any questions, we need any suggestions. So please note we have many key opinion leaders, especially Professor Magda Menzi, but that doesn't mean everyone starts to email her.
No, please.
No, but we'd really like to emphasize the fact that today there is this apprehension that there are not enough leaders, really not enough clinicians talking about the peripheral nozzle, but this is not true. So we have a lot, and this community is growing. So in case there is anything, any doubt with using the nozzle, please, you can speak to them because we have hygienists, we have implantologists, periodontists, dentists on this particular group of key opinion leaders supporting the use of Perio Flow nozzle.
Okay, so now we want to show you two clinical videos with the, so you can move on the videos, Neha, and I try to comment during the video. So you can see the use of the Perio Flow nozzles. I'm sorry, also here I'm using the old version, the first version, and in the next videos, the second version. I'm making the new videos with the new Perio Flow nozzles. But in this case, you can see the use of the Perio Flow nozzles to remove the biofilm from a transmucosal tunnel around an implant in the buccal sides and especially in the palatal sides, where it's very difficult to go into the transmucosal tunnel with a standard or conventional instrument, but it's very easy with flexible nozzles. And this is pockets in the mesial part of this tooth where we use the Perio Flow nozzles before using the Piedzon and the PS or the other tips to remove the calculus. So it's very easy to insert into the pockets and in the transmucosal tunnel, especially during the active therapy, because the tissue, so we have a laxity of the tissue, so you can move into the pockets very easy. When you work in the supportive therapy, you have more compact tissues, and sometimes it's more difficult to go into the pockets with the Perio Flow nozzle. But during the active therapy, it's very, very easy and very comfortable for the patients. So we can move in the next video.
Magda, this you're using the first generation, so this video would be about 8 years old. So you are using the Perio Flow nozzle right from the start.
Yeah.
From the absolute first generation.
So do you remember my first clinical study where we treated 44 patients with aggressive generalized periodontitis with the full mouth erythritol powder air polishing therapy? So the actual GBT, but it was the same.
Yes.
During the active therapy in this group of patients, we were using.
About it. Yes.
Yeah, so we were using the Perio Flow nozzles in the active therapy.
That's amazing. Okay.
Okay, and in this other video, I want to show you a case in a patient with periodontitis and periimplantitis, and in this case, I want to show a borderline clinical case because there's a very severe periimplantitis in this incisor with a screw retained. So you see the separation here. This is the probing depth with the plastic probe. So it's very, very severe. This is the usual GBT treatment in a periodontitis patient, but where we identify during the step 1, so during the assessment, also the periimplantitis on this tooth, on this implant. So I was treating these patients, so I removed the crown, and if we can move quickly, it would be
Magda,
better.
is this particular video also available on our website?
Yes, you can find this video in your website.
Okay, because I'm sure everybody watching this right now would want this video and want to add it in their presentations. So I think, okay.
Yes, because here you can see, for example, something important. So I think that this kind of treatment is just for dentists and not for dental hygienists in this case, because in this case we need to remove the crown. So you need to be able to do that and ability to do that. And I'm using, in this case, the Perio Flow nozzles in a very severe condition, pressing my finger on the mucogingival line in a very acute and severe periimplantitis. So it's borderline, but it's just to show you that also in these conditions, in a very expert hands, there are no problem, and we can. So if I had a problem in these cases, so if you use in other cases more, so less severe, the use of the Perio Flow nozzles is very safe. It's very, very safe. And I try to recommend you to use the Perio Flow nozzles to treat the periimplantitis, because it's impossible to remove the biofilm with the other instruments. And this is the reason why the non-surgical therapy in the periimplantitis is not effective in the literature, because they use the wrong instrument. If they try to treat the periimplantitis with the plastic curette, I'm sorry, so they are doing nothing. And so the results, it's going to be zero. But if you treat the severe periimplantitis non-surgically with the modified GBT, so a GBT dedicated for the implants, where you use carefully the Perio Flow nozzles, the PI tip, in repeated appointments, in more than one appointment, you can really obtain the success. And so try to move ahead in this field, because it's very important to understand that the benefit that we really can have with these instruments. So we have a big potential with the Perio Flow nozzles that are around the implant. Okay, so I think that we can move on, because it's always the same. So we can change the slides.
Okay. Yes, so this is again always the question asked about the correct usage. How do we use it? So once again, we have recorded on the 19th of October in detail about the correct usage of the Perio Flow nozzle. So please have a look. But it's important, once again, to use at least 50% of power. Please do not reduce the power, because you're not going to be efficient. And this is literature supporting my statement. As Magda already showed you, ideally, the safest way to work, if possible, is to compress the site where you're working with your fingers, if possible. This would reduce your risk of any complication. Of course, you must only and only insert the nozzle up to, for example, if you have a 6 millimeter pocket, please insert it up to 6 millimeters. Do not push it in the pocket or do not use it at 6 and retract. Let's keep it simple. If you find any resistance, the minute you feel the resistance, stop using the nozzle. Do not push it in. That's it. Because otherwise, we want to make the use of the nozzle very simple. So if you have an assessment in front of you, you know your probing depths, 6, 7, insert the nozzle. We have markings, insert the nozzle, activate, and as you come out of the pocket, you will be removing the biofilm very safely. Minimum, once again, 5 to 10 seconds per site is recommended. For a natural tooth around implants, please go all around the implants, which is important to remove biofilm because most of the time the bone loss is circumferential. So today we have over, I would say now 40 articles, which are, of course, include a couple of them which are in vitro studies, which have been done on natural teeth as well as on implants. So we will quickly go. I know we have completely crossed the time frame here, but we will go over the clinical evidence. But most important is the recent evidence. But one thing I'd like to focus on is we have evidence on natural teeth starting from the year 2010, where we had our first study done by Professor Mombelli, University of Geneva, where he used the first generation of the nozzle, as you can see, and compared it to hand instrumentation. Clearly, as you can see, a lot more comfortable in comparison to using the hand curettes. We had another study, again done by the Department of Geneva, Professor Mombelli, where he compared Perio Flow nozzles to ultrasonics. Again, very safe, no complications. This study was a 1-year long-term study. So that again says a lot, especially with respect to the reduction in the number of residual pockets. This study where Professor Fleming, this was done in 2012. Professor Fleming, once again, as you can see, this is the older generation of the Perio Flow nozzle. He used it for full mouth airflow therapy, very similar to what Magda had done, but of course with the second generation of the nozzle. And I think, Magda, your study was with erythritol powder. This study was done with the glycine powder. Yes. And once again, absolute safe, no complication, and a lot of positive results with respect to clinical outcomes. We claim a lot, we are safe on the dentine, we're safe, but I think it's important every time we make a statement, let's be rest assured that we have evidence to back this up. So in this particular study, safety on dentine has been demonstrated in comparison to using hand instrumentation and ultrasonics. So once again, the first generation of the Perio Flow nozzle was used, and you can see, I will not go over this. You will have the presentation. I'm sure you know about this study. This was an in vitro study, and clearly you can see whether it's clinical efficiency, recolonization with respect to new bacteria, the substance loss, or the roughness that is produced. Because remember, every time we use the Perio Flow nozzle, we're going to be in contact with cementum or dentine. So it's very important that we are safe, and especially in compared to the hand instrumentation with respect to ultrasonics, absolutely this study says it all. So Perio Flow nozzle is the safest, producing absolutely no changes on the surface of the dentine and producing, I would say in terms of clinical efficiency, the highest removal of biofilm and absolute smooth surface without any scratches. So the conclusions from this study are extremely favorable for the Perio Flow nozzle, especially on patients with supportive periodontal therapy. So as you can see, in the past, the focus was only supportive periodontal therapy. Repeated biofilm removal absolutely is safe when you have residual pockets. We have another study, a very important study from Professor Wenstrom, which was done in 2011. Once again, the older generation of the Perio Flow nozzle, where he compared it to ultrasonics. And clearly, when you compare both the technologies, that you can see Perio Flow is a lot more comfortable in comparison to ultrasonic. So patient compliance, very important. And especially now we have the new nozzle, it's going to be definitely improved and only improved. We have another study done by Professor Skuljan and team where he used the Perio Flow nozzle. So for just, I did not realize this powder bottle, everywhere, wherever the studies have been done with erythritol, we have tried to put this bottle to again talk about the new erythritol powder formulation and the bottle. In this study, again, Perio Flow nozzle has been compared to hand instrumentation. So again, with respect to patient compliance, maximum patient comfort when a Perio Flow nozzle was used. Definitely safe option when we have patients on maintenance. We do also have some consensus with respect to Perio Flow nozzle. We had a consensus in 2012, as you can see, as well as a consensus which was done in 2015 with respect to safety, efficiency, and comfort of the Perio Flow nozzle. Moving on to clinical evidence with respect to implants. I want to make sure, Magda, you have enough time to explain our new study. So I'm going to go a little fast now. I'm sure you all know all these studies.
Yeah.
We have the entire articles also available on our SharePoint, SDA SharePoint, and you have full access to all the articles as well. We also have evidence where we've compared Perio Flow nozzle to lasers, and honestly, with respect to clinical outcomes, there is not much difference. Speaking about systematic reviews, this was done by Professor Schwartz in the year 2015. Once again, absolutely safe in comparison to using hand instrumentation. Use of Perio Flow is equally effective. In fact, I would say more effective, but equally safe when we talk about using Perio Flow to remove biofilm around implants. We do have a lot of in vitro studies as well, as you can see. This was, I would like to just talk 2 minutes here. This is an important study because this was the outcomes of a meeting that was done in London at the Perio in the year 2015. Clearly, the consensus, we had 17 clinicians attending this across the globe. And we do have a consensus that when we talk about using the Perio Flow nozzle during non-surgical treatment, it is absolutely safe and highly efficient, especially in comparison to conventional procedures today. Magda, floor is all yours.
Okay. So now, just to conclude in terms of clinical evidence, I'm very happy to share with you the new paper that we published. So it's accepted on clinical or investigation. Yes. Yeah, finally. We worked a lot in a B-centric study with University of Ferrara as well. So with Professor Leonardo Trombelli, he is my mentor. And I work with him in this 1 year and a half on this paper, and finally it is in the literature. Probably the next month you could find the paper in PubMed available, but anyway, I can share the data with you because finally it is accepted. So we first tested finally the use of the Perio Flow nozzles during the initial therapy in patients affected by periodontitis, stage 3 and stage 4 grade C patients, generalized stage 3 and stage 4 grade C patients, so very severe periodontitis patients. So we made a randomized clinical trial, very well designed, and I want to thank also our statistics because they They worked very well with us in terms of analyzing the data. And we had two groups. In one group, we applied the entire GBT protocols. So with the Perio Flow nozzles in the pockets from 5 to 9 millimeters, combined with the PS tip. And in the other group, in a randomized way, we don't use the Perio Flow nozzles, but just the PS tip in these experimental sites. So the aim was to see if there is any difference in terms of pocket closure. This was the first outcome. And in terms of secondary outcomes, so bleeding on probing, reduction of probing pocket defect, clinical attachment level, recession, plaque index, and so on. But also, the aim of the study was to verify and demonstrate that there are really no side effect or contraindication in using the Perio Flow nozzle in combination with the PS tip during the active therapy. And if you go ahead in the presentation, I want to show you the results and the data of the study.
So Magda, can we say that this is the absolute first study using the guided biofilm therapy protocol in patients with severe periodontitis, means initial therapy?
Yes, it is the first study. So yes, because we had, and I published in 2016 the study about the aggressive periodontitis, but it was not GBT. So yes, if you now search in PubMed the GBT acronym, you can find a publication. To be honest, we have a previous publication, so like 2 months ago, we published also the other study where we compare the use or not use of disclosing plaque agent in the patient in the supportive therapy, and we named the protocol, so the GBT protocol. So in terms of name of guided biofilm therapy, we have just two paper, but in terms of active therapy, this is the first, absolutely the first randomized clinical trial that we have in the literature. Yes.
Okay, so this is very important to emphasize, because I think after this paper is published, the fear of using it, definitely, I think we would be able to overcome this amongst our clinicians.
Yes, of course, because if you move in the next slides, you can see that, to be honest, we obtain, okay, so you can see here in the graphs, this is the test group and this is the control group. So here we use the Perio Flow nozzles combined with the PS tip, and here we use just the PS tip. So in terms of probability to close the pockets, comparing, so according to the baseline probing pocket defects, there are not so much difference in using or not using the Perio Flow nozzles in the active therapy. But it is just a little bit better, so like 5% better. So this is something, but it is not statistically significant difference. So we need to be clear on that. But what is more important? So if you go ahead in the next slides in the results, the most important result is this. If we look at these two categories, two clusters of outcomes, so closed pockets without bleeding on probing, and closed pocket with residual bleeding on pockets. So if we put together these two results, that means that we closed in both groups, with or without the Perio Flow, with the GBT protocol, more than 80% of pockets, deep pockets, just with non-surgical therapy in 3 months. And we have more or less the same results without the Perio Flow, a little bit less, so 76, 75% of closed pockets. but it is an extremely great results because it's higher, the percentage of pocket closure is higher than the Benstrom results, than Tomasi results, than the previous study. So the real important conclusion is that with the GBT protocol, we can close more than 80% of active pockets, severe pockets, just with the non-surgical therapy. And that means less need of surgery. And this is a very important result because we reduce the needs of surgery, we reduce the biological cost for the patients, the economical cost for the patients, and we can maintain the residual pockets with the GBT, the periodical GBT during the time. And this is a revolution in the periodontal world that is surgical, 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 surgical. So we can really obtain very great results with the GBT treatment and active therapy. But if you want to go more into detail in the next slides, I can also share with you these important results that is reported in the paper. So we realized that the multi-rooted teeth with moderate pockets, so 5-6 millimeters, they really received more benefit if you use the Perio Flow nozzles combined the PS tip compared the more deeper sides. So if I need to give an indication, so please use the Perio Flow nozzles during the active therapy, especially in the multi-rooted teeth where you have moderate pockets, because the probability to close those pockets is 56% if you use the Perio Flow nozzles and just 40% if you don't use the Perio Flow nozzles. So probably in a very difficult anatomy like the furcations area, the multi-rooted area, if you add the Perio Flow nozzles to the PS tip, you can really improve your clinical results. This is the, in brief, in short, the conclusion. And then I would like also to share with you quickly the other papers that we published recently. This is an in vitro study where we tested the PS tip, PI tip, and the Perio Flow nozzles with Perio powder and the plus powders around implants. Where we simulated a pocket of 6 millimeters and we contaminate the implants with red ink, that is the simulation of the biofilm. And in the results, if you move on in the next slides, we clearly demonstrated that we can remove the biofilm in between the threads just with the powders, not with the tips, neither with the PS and neither with the PI tip. So you can work just in the external part of the threads with the PI tip, but you can remove the biofilm also between the threads with the Perio Flow nozzles and with the powders. And the powders win against the tips, absolutely, and very significantly. Here you can see the p-value, so 0.001. So very, very, very significantly. And there is no difference between glycine and erythritol powder. A little bit better with the plus powder compared to the glycine powder, especially in the 45 seconds treatment. So this is what you told, Neha. So 5 seconds sometimes is not enough. So you need to move more. So sometimes you can stop your activating movement, but you need a little bit more to remove effectively the biofilm from the implant surfaces. And then if you go ahead in the last slides, We also published some years ago, I don't remember, in 2017, this very important article, Neha, because we treated very severe cases of periimplantitis without having any evidences about the using of the Perio Flow nozzles in the active therapy in periimplantitis treatment.
This was GBT.
Yes, it was exactly the GBT.
Plus the doxycycline.
Exactly. So at the end of the treatment, so we add the topical doxycycline. And if you look at the results with this combination, and I believe a lot in this combination, if you go in the next slides, you can see, okay, the results. So in terms, if you look at the graphs here, so we started in average with pockets exceeding 7.5 millimeters. And after 3 months of that treatment, we closed these pockets with a lot of gain of attachment and very, very few recession. So no contraction of the tissue, but gain of attachment on the implants. So, and this is another very important point. And if you look at these columns, you can see that during the time, the pockets, the very severe pockets, 7 millimeters and 6 and 7 millimeters, after 3 months, were completely closed. So we conclude the study after 1 year with implants with transmucosal tunnel of 4-5 millimeters that you can maintain with the supportive therapy with the Perio Flow nozzles with non-surgical treatment. So avoiding the surgical approach, avoiding more costs for the patients and more biological risk for the patients. So the non-surgical therapy also in the treatment of periimplantitis is the future. We need to work a lot, I know. We need to have a lot of skills, but it is the future.
Absolutely, because there is nothing else today available now.
No.
Nothing else that would be effective and safe at the same time. So
exactly.
Excellent. So just to give you all a recap, we do have a lot of literature concised into one document. Of course, we do not have the latest 2 studies from Magda in here, which once published will be all in this. These documents are also available, so please use these documents, read them and share them. And we can assure you, I think Magda and myself, that using the Perio Flow nozzle is absolutely safe and predictable, I would say.
Yeah, and try to trust us and use it, please, because we need to improve the clinical benefit that we can have with the combination Perio Flow and PS tip. Okay, thank you very much, Neka. Sorry for the time, but it was
and please remember all of you to log in during our live panel discussion on the 26th of November. Okay, bye-bye.
See you, Neha. Thank you. Bye.